In the video where I demonstrated cleansing around the surgical drain, I wanted to ensure that the manner in which I cleansed around the drain was clear. So I made this little diagram here. What you've got is the drain in the middle, and you have to imagine the drain is coming out. So you'll, at this point, you've removed the top dressing. You've removed any drain sponges that may have been around the drain. Then you've changed your gloves. You've washed your hands. And perhaps you want to apply a new set of clean gloves because you may have to hold the drain up with one hand as you cleanse around it. You never cleanse on the drain itself. You don't want fluid dripping down the drain to the drain site. Unlike a urinary catheter where you do cleanse the urinary catheter itself, you don't cleanse the drain itself. That's a good way to have bacteria running into the wound. So you don't cleanse the drain itself. You just aim to cleanse at the base of the drain. That's it, and work your way out. So you may have one hand with a glove on holding the drain upright as you use the other hand to cleanse around. This would be clean glove technique. You'd be using a sterile dressing tray with forceps, the usual way, with normal saline. So in essence, what you want to do is cleanse around the drain, check your pledgets, make sure they're not too soiled, as I showed you how to do that in the video. If they're not too soiled, you continue on and cleanse around another outer circle. If your pledgets aren't too soiled, you continue on and do the third circle out. If at any point in time your pledgets are too soiled, you need to do that part again. Okay, so that in essence is what we're trying to achieve. I've seen this done for many years by students and myself, and I've come to the conclusion that the best way to do this is not to try and do each circle as 360 degrees, but to split each circle up into 180 degrees. So you hold the drain up, you take your first pledget, you cleanse around 180 degrees, check your pledget. If it looks good, get rid of it, get a new one, cleanse the next one to make 360. Then go to number 3, cleanse 180. Pledget looks soiled, cleanse it again with a new pledget. Looks good, get a new pledget, cleanse around number 4 to complete the second circle. Then the outer circle, 180 degrees, check your pledget, looks good, get a new one, the final 180 degrees. So you do each circle at 180 degrees increments. So at the very minimum, you're using 6 pledgets and going around 6 times. 1, 2, 3, 4, 5, and 6. And the reason for this is when I've seen students, countless number of students, try to do 360 degrees with one pledget at one time, most of them cannot adequately do 360 degrees. There's a point that they miss, they're not cleansing well, it's not thorough. So I recommend dividing each circle up into 180 degrees portions.